Hello, welcome to the North Country Medical Reserve Corps Unit Volunteer Orientation. The purpose of this orientation is to introduce volunteers to New Hampshire's public health network system, to familiarize volunteers with how the Medical Reserve Corps fits into the infrastructure of the public healthcare system, to communicate the role and activities of the Medical Reserve Corps both nationally and within New Hampshire, and to provide the volunteer with an overview of the Northern New Hampshire Medical Reserve Corps Unit's policies and procedures. In 2013, the New Hampshire Department of Health and Human Services established a strategic partnership to align multiple public health priorities into a single integrated system. Understanding there are different needs in different regions of the state, the Department of Health and Human Services divided the state into 13 public health networks and created single contracts with host agencies. In the North Country, the host agency for the Regional Public Health Network is North Country Health Consortium in Littleton. The purpose of the regional public health networks is to integrate multiple public health initiatives and services through a network of community stakeholders. The 13 regional public health networks in New Hampshire are inclusive of every city, town, and community within the state. The North Country Public Health Network is geographically the largest public health network region in the state. Designated on this map in green, the region covers all of Coos County and northern Grafton County from the Canadian border to the Haverhill area, which is approximately 3,200 square miles and about 1/3 of the state. This area is home to approximately 54,000 residents and is the most rural, mountainous, and least populated of all the public health networks. The Regional Public Health Network mission is to expand regional infrastructure and coordination around public health services and to work with partnering agencies to deliver public health services that include chronic disease prevention, health promotion, prevention of substance misuse, public health emergency preparedness and response, and strategic planning to mitigate health impacts of emergencies, catastrophic events, and natural disasters. Public health networks are a collaborative of municipalities, health and human service agencies, nonprofit organizations, and private businesses that work together to improve the health and safety of the region and to prepare for public health emergencies. The primary role of public health networks in New Hampshire is to ensure coordinated and comprehensive delivery of essential public health services. New Hampshire's 13 public health network agencies are funded by New Hampshire Department of Health and Human Services and New Hampshire Homeland Security and Emergency Management. Each regional public health network is responsible for developing a regional public health emergency annex plan, which is referred to by the acronym RFE. The RFE is a regional specific annex to the local emergency operations plan that exists in each town within the public health region. The RFE provides an organizational and operational framework to prepare for, respond to, and recover from public health emergencies in the North Country region. The Regional Public Health Emergency Annex Plan is adapted to the specific changing needs of the North Country. The plan is not designed to be a standalone solution to emergency response for the North Country, but rather to act as a guide for a region-specific component to the larger statewide response. The plan is updated every 2 years, and between updates, the plan is exercised through practice drills, then evaluated to ensure that it meets and maintains the most relevant needs of the North Country region. Part of the RFE plan includes the responsibility of risk communication, mass prophylaxis response, support for medical surge in alternate care sites, and includes guidelines and expectations for hosting the multi-agency coordinating entity and emergency volunteer management response, which directly involves the Medical Reserve Corps unit. On a broad scale, North Country Regional Public Health Network works to prevent disease, prolong life, and promote the overall health of North Country communities. The North Country Regional Public Health Network collaborates with statewide and local partners to prevent epidemics, pandemics, and the spread of disease, to protect against environmental hazards, to prevent injuries, promote and encourage healthy behaviors, to respond to and prepare for disasters, and when necessary, assist communities in recovering from public health events, and to assure the quality and accessibility of healthcare services. The North Country Regional Public Health Network does this by consistently updating, exercising, evaluating, and maintaining the Regional Public Health Emergency Annex Plan. In New Hampshire, each regional public health network is home to or closely aligned with a local medical reserve corps unit. In the North Country Health Consortium in Littleton is the hosting agency of both the North Country Regional Public Health Network and the Northern New Hampshire Medical Reserve Corps unit. The Northern New Hampshire Medical Reserve Corps unit's service area is northern Grafton County and all of Coos County. The service area covers the same counties, regions, towns, and populations that are served by the North Country Regional Public Health Network. The Northern New Hampshire Medical Reserve Corps unit enlists volunteers throughout Coos and northern Grafton County regions, as well as volunteers across New Hampshire who wish to exercise their volunteerism as a statewide response. This group of volunteers provides auxiliary support to emergency responders, private and public health agencies in time of need. The North Country Regional Public Health Emergency Annex Plan maintains volunteer support as an essential ongoing component to emergency response. The Northern New Hampshire Medical Reserve Corps unit follows the national philosophy for volunteerism that prepared communities lead to prepared regions, and prepared regions lead to prepared states, and prepared states lead to a prepared nation. The Medical Reserve Corps concept of operations relates to establishing groups of volunteers who are interested in strengthening local public healthcare systems and providing help in emergencies, integrating and supporting existing programs and resources, and identifying, credentialing, training, and preparing in advance of unit activation and deployment. The Northern New Hampshire Medical Reserve Corps unit's concept of operations is covered in the Volunteer Manual, which describes the unit's mission, training and operational needs, and expectations for volunteers and unit leaders. The concept of operations retains a focus on serving the broad geography and culture of the region by leveraging community response with existing public health partners and programs. MRC volunteers are an important part of our region's ability to respond to large and small-scale public health events. Following the September 11th attacks in 2001, President George W. Bush called for establishment of a volunteer system to strengthen the country's culture of service and help find opportunities for every American to start volunteering. This led to creation of the Freedom Corps, which was established with three components: to respond to crisis, to rebuild communities, and to share compassion with the world. The Medical Reserve Corps was created as an extension of the Freedom Corps in 2003. One of the important drivers of the Freedom Corps volunteer system was to establish some structure around spontaneous volunteers and to prevent liability issues through pre-credentialing of volunteers. On a national level, what also inspired the creation of Medical Reserve Corps was an unexpected and overwhelming citizen response to 9/11. When people came forward as spontaneous volunteers, there was no system in place to verify volunteer credentials. This response added to the mass confusion and created both an underuse of highly skilled volunteers and an overuse of underskilled volunteers in the days immediately following the events of 9/11. The Medical Reserve Corps offers free training to its volunteers. It provides a background check and conducts credentialing of volunteers who have an active professional license. This organized approach allows Medical Reserve Corps volunteers to respond with confidence to emergencies, and it provides first responders the assurance that Medical Reserve Corps volunteers have been vetted through a consistent and structured process. Medical Reserve Corps units are designed to support public health and safety professionals during emergencies and to participate in emergency preparedness and community public health projects during non-emergency times. Some examples of how Medical Reserve Corps help in emergencies are shelter assistance when people are displaced due to natural disasters such as hurricanes, flooding, or forest fires, or in support to emergency responders such as security, logistical support, and traffic control. Medical Reserve Corps volunteers can be involved with direct care or indirect support, such as setting up shelters, providing education to their community, traffic control in emergencies, distribution of medical supplies, and if professionally licensed, vaccinating during pandemics or to prevent influenza, and at times providing direct medical care. In the North Country during non-emergency times, some of the community-based work the North Country Public Health Network does with support of the Medical Reserve Corps is school-based influenza clinics, community health fairs, working with the New Hampshire Food Bank to distribute food, and in community-wide emergency preparedness trainings and drills. Another way that Medical Reserve Corps volunteers work in the community is by becoming trained to teach personal, family, and pet emergency preparedness. An example of why preparedness trainings are important is when looking back at the common reaction people had at the start of the COVID-19 pandemic. Most people in New Hampshire and the nation can recall the general public's response to stay-at-home orders in 2020. Many people, trying to address family preparedness, engaged in panicked and at times aggressive overpurchasing. This led to nationwide and local shortages of general household supplies and products. Family and personal preparedness trainings can teach communities reasonable recommendations for personal and family emergency preparedness. These are important trainings for people in our communities to receive at any time to always be prepared, and can be delivered by trained Medical Reserve Corps unit volunteers. Although the title Medical Reserve Corps indicates volunteers may be required to have a medical background, the Medical Reserve Corps is comprised of volunteers from both medical and non-medical experiences. Medical Reserve Corps volunteers offer support with administration, outreach, logistics, safety, and direct healthcare services. Some examples of Medical Reserve Corps volunteer activities over the last few years have been health screeners at COVID-19 clinics, vaccine registration specialists, vaccinators, pharmacists, nurses, paramedics, EMTs, medical assistants, assisting with preparing and drawing up vaccines, post-vaccine observers, logistical support, outreach, and educational leaders. The Northern New Hampshire Medical Reserve Corps unit is always accepting new volunteers. Individuals who are interested in becoming a volunteer must be a minimum of 18 years of age. Applications for the Northern New Hampshire Medical Reserve Corps unit can be completed at the newhampshireresponse.org website. New Hampshire Response website can be accessed directly through the web or through a link on North Country Health Consortium's website. New Hampshire Responds is a secure statewide database of volunteers that categorizes credentials and licensing for cross-reference. At the time of application, the website will direct volunteers to the most proximal Medical Reserve Corps unit. Once an application has been completed on New Hampshire Responds, the Medical Reserve Corps unit leader is notified and will contact you. The next step of the process includes the volunteer applicant signing a consent for criminal background check, reviewing the Medical Reserve Corps handbook, and signing an acknowledgement of having reviewed the handbook, completing a HIPAA training. The volunteer vetting process takes between 1 and 3 weeks. Once a volunteer has been vetted with the Northern New Hampshire Medical Reserve Corps, the volunteer has no binding agreement to deploy, no required length of service. Volunteers have the choice of which activities to participate in. All volunteers have the right to decline of any mission for any reason. Volunteers have no requirement to volunteer far afield, but do have the option to do so through specialized training on the FEMA website. The National Medical Reserve Corps organization has core competency trainings that include Introduction to the Incident Command System, National Incident Management System, National Response Framework, Personal and Family Preparedness, HIPAA and Disasters, and the recommendation to participate in regional public health drills and exercises. Currently, because of the pandemic, core competency trainings have been temporarily waived. Volunteers are encouraged to go to MRC Train to complete these trainings at their convenience. Once completed, a certificate of completion can be downloaded or printed and sent to the Medical Reserve Corps Unit Volunteer Manager. Trainings at the state and local level are determined by activation level and response of the MRC unit. Medical Reserve Corps partnering agencies sometimes have training requirements that are specific to the type of deployment being offered. Northern New Hampshire Medical Reserve Corps unit training requirements align with regional deployments and requirements that are set by organizations who request volunteer support. Although the National Medical Reserve Corps competency trainings have temporarily been waived due to the pandemic, volunteers are strongly recommended to complete the ICS 200 training to gain an understanding of the incident command system that is followed for most deployments. This training is free to MRC volunteers and can be found at the website MRC Train. Additionally, deployments relating to the COVID-19 response in New Hampshire include the required training for volunteers, mobile and alternate site vaccine clinic training. This training can be found at a link on the North Country Health Consortium website. Once a volunteer has been vetted and fully trained, they will begin to receive notifications for deployment opportunities. The method for activation of MRC volunteers in an emergency response or planned deployment is through our partners at New Hampshire Alert Code Red System. Volunteers may receive notification by phone, text, and/or email with detailed instructions. Most deployment notifications include information to follow a sign-up link. This link can be followed on your phone or your computer. We use the platform Sign Up Genius to organize sign-ups and to track volunteer hours. Even if volunteers are fully vetted and trained, volunteers should never self-deploy to any event. For the purpose of volunteer safety and situational awareness of the MRC unit leaders, volunteers must comply with deployment protocols. In New Hampshire, Medical Reserve Corps volunteers are protected under Section 50817 and 50817A, which state that volunteers are protected from liability when they are activated in a commissioner-declared public health incident or in a governor-declared emergency. All volunteers are also covered under workers' compensation if they are injured while volunteering. In a public health incident or public health emergency, volunteers are added as part of the vetting process to an emergency management worker form that is signed by the Commissioner of the Department of Health and Human Services prior to activation. The emergency management worker form allows the volunteer to work under the state emergency declaration as an emergency agent of the state of New Hampshire. Northern New Hampshire Medical Reserve Corps units pledge to its volunteers is to offer ongoing, relevant, and interesting training opportunities, to provide appropriate equipment, supplies, an ID badge, and volunteer handbook to each volunteer. We will only share your contact information with partners requesting your volunteer services after you have indicated you are interested in volunteering for their event. We will strive to provide volunteers with opportunities to work within their own fields of expertise during deployments. Thank you for joining the Northern New Hampshire Medical Reserve Corps Unit Orientation Training. This concludes the training. Please reach out if you have any questions.